We are delighted to be joined by Matt and Bianca, who've been working in Bristol on their monitoring and evaluation. So whilst Bianca is now a fellow Ageing Better employee working in Greater Manchester, her previous role up until a few weeks ago was as the Age-friendly lead in Bristol, who has also been working closely with Matthew Jones, who is a professor of public health and community development at the University of the West of England on an evaluation for the Age-friendly programme. So as we go through, if you have any questions for Bianca or Matt, please do add them to the chat and I'll ask them both to respond at the end. But I'm going to ask Matt and Bianca a couple of questions about their experience. So to start with, I'm going to start with Bianca. If you're happy just to share a little bit about what overall did monitoring and evaluating your age-friendly programme in Bristol look like?
Sure, thank you. And thanks for the intro. Reminder that I'm putting my old hat on. So yes, in terms of Bristol, I think we're in a really good place actually with the evaluation. Just before I left a couple of weeks ago, and Matt can come on more to talk about the new age-friendly evaluation report that's come out from there. I'll start with monitoring actually. So in terms of monitoring of our age-friendly action plan, which was refreshed in 2021, I was monitoring each of those actions. There are 41 actions under that, split across the 8 domains fairly evenly. And each of them had an organisation, or in some cases a sort of department within Bristol City Council or within the combined authority that had signed up to deliver on that action. So I was just before leaving working on an update of that. So a sort of red, amber, green rating for each of those actions. Is it yet to start? Is it ongoing, or is actually a kind of milestone being achieved on that? I've got about 85% of the way there. So actually most of those actions were really happening, and I've got a 100-word update on each of those. And that's a really good way of making sure that people remember they've committed to doing something. It isn't just kind of showing off about their work, or creating an action plan that then sits in a drawer. And also in terms of public facing, I'm really hoping that update on the action plan will go out to sort of wider public, so they can see that Age-friendly Bristol is something that is meaningful, not just a sort of tick box exercise to get an accreditation for the city. And a quick tip on that actually is make sure, this sounds really obvious, but if another organisation or even within your own organisation is committing to an age-friendly action, get it in writing, store that somewhere. I was really grateful to my past self that I had each of those emails stored, so I could just reply to them and say, where is this at? Please could you come back to me within 3 weeks? So that's in terms of monitoring, and then quickly in terms of evaluation, we'll talk in more detail later, but we were really fortunate that our age-friendly work started under an Ageing Better funded programme. I know lots of people in the room, that will be their situation as well, so we could bring in the evaluation that Yui and the community researchers had done for us on Bristol and Better, and also some age-friendly work that we commissioned around housing and transport action groups from Bristol Older People's Forum. And we could actually bring some of the qualitative and quantitative data from that into our refresh strategy. But I was just thinking this morning, actually, a point on that is, even if you don't have a library of evaluation from an Ageing Better programme in your area, there will be funded programs. There was quite a lot of funding for older people over the last few years. There will be funded programs probably in your area or adjacent to your area. Speak to them. They may be in a situation like Bristol is, with having this amazing library of, in some cases, statistically significant evidence on things like isolation and loneliness, on social prescribing referrals, things like that, surveys that have been done that they really want to be shared and to feed into other strategies. So do take a look at that, and the UK network's a really good way to find out about that. And then finally, Matt will come on to talk about it, but we have a evaluation report of about 25 pages on how age-friendly has impacted sort of wider political system as well, and also looks at other age-friendly areas outside of Bristol and what their approaches are, how age-friendly sits, and sort of compares and contrasts that. So in a way, that's a slightly more philosophical piece, but it really does evaluate sort of the impact of having age-friendly on the agenda in Bristol over the last 5 years.
Well, Matt, I think that's your cue. Are you able to tell us a little bit more about the evaluation that you worked on for Bristol?
Thank you, Charlotte. Yes, I suppose one of the things, just by way of context, is that UE was a partner, an evaluation partner, way back at the beginning. So it's been a long relationship, and I think has already been mentioned, those kind of long relationships with research organisations can be a really useful thing. We've heard lots of great things already, and I think they chime so well. But one sort of reflection, I think, just about what our evaluation looked like and what we sort of had to do was the WHO guidance it provides a really excellent framework for supporting an understanding of whole systems change. But the challenge we identified was that there are so many areas of potential impact. The WHO flower framework, it can be quite overwhelming to newcomers, to people outside maybe, our audience today, especially stakeholders who maybe not necessarily signed up to it, who aren't really, they don't quite get the Aging Well agenda in amongst all the other priorities. So that makes it hard to communicate benefits in crisp, simple terms, in the ways that captures people with a short attention span. So really, with all that in mind, there's also this issue that we're talking about huge population and systems issue here, and even the best well-resourced age-friendly schemes, I mean, they're going to have quite limited impacts on those top-line secondary indicators that we may feel are really important, but what could be realistically impacted upon? And this is a problem which is faced by other whole city, whole systems change kind of programs, where sometimes audiences can feel a bit jaded or they're kind of asking the so what question. And that has real implications, because it can mean that these sorts of schemes can find their funding whittled down and diminished as key decision makers become a bit sort of they want to see what the impact is. With this, as Bianca mentioned, because the Aging Better Fulfilling Lives lottery funded scheme was behind that, an answer to some of that was driven by the focus on the impacts of the program potentially on loneliness. So it provided a kind of focal point. And if there's one learning, then what could be focal points which teams can reasonably think about what they might create impact on. We had a theory of change where we wanted to look at the key proxies that might explain how activities that are sponsored, supported, influenced by age-friendly work might plausibly be connected through to the sorts of impacts on things like well-being and loneliness. So as Luke pointed out, some of these things don't need to be complicated, but some of them are quite challenging, and maybe might say a bit more about that.
Thank you, Matt. So a good reminder to think about when we're creating that whole evaluation. You might not be able to feasibly think about everything that's in those 8 domains and all of the nuance in there, but kind of align it perhaps with the strategic focus that you have locally. So that's a good sort of high-level overview of your work, and I'm thinking back to what we shared earlier around evaluation audiences and who those different audiences are and what you might need to do or plan for those different audiences. Bianca, I wondered if you could share a little bit about who some of the key evaluation audiences were for you and how that impacted your monitoring and evaluation.
Yeah, sure. So I think in terms of our age-friendly specific evaluation, I think it is those people who signed up to the actions as well. So sort of saying to them, we are actually seeing what the kind of wider system change is as a result of the combination of these kind of 41 different projects, but in some cases specific strategic work is. And then as well, a lot of the people that we were talking about in the breakout rooms earlier, so senior decision makers in local authority as well, making the case that we do have some real evidence and some really good sort of stories from older Bristolians on how this kind of work is making an impact and how it can make an even greater impact if there's more kind of political buy-in, there's more support for it. And then I think in Bristol as well, our audience for this report that's coming out actually includes quite a few people from health, with the move to integrated care systems. Integrated care boards, I think, are even more important to get on the age-friendly agenda than clinical commission groups previously were. And there is a lot of focus on what they call prevention. There's also a lot more talk, at least, on wider determinants of health, which very much sort of maps onto age-friendly. So I think in terms of there's quite a bit around the move to integrated care and the implications that has for age-friendly in Matt's report. So hoping that in Bristol, this today is almost a soft launch for the evaluation report, so I'll pop it in the chat so you guys are the first to see it, but hopefully there'll be a launch event happening in Bristol or for a Bristol audience, and really hoping that will include integrated care board members as well as people in adult social care as well. And I think as well, the combined authorities. So in Bristol, I think I mentioned, or maybe I mentioned the breakout group, that we were doing some work. We had a remit to work slightly outside of Bristol around employment with the West of England Combined Authority. And I think getting that evaluation report out and hopefully a state of ageing is there might be capacity to do that within Bristol, getting that under the nose of the Combined Authority as well, and seeing how they might want to make, like Manchester, Liverpool, other wider regions, and sort of have a real place for ageing on their agenda as well. So that's ambitious, but that's the audience, and I mean, and older people as well. I think older citizens, Bristol citizens, is more for that update on the action plan than the evaluation report. But certainly I think it's written in a way that should be accessible to a lot of audiences.
And on that older people's point, obviously there's your kind of audiences, who the evaluation is for, but also the other side that Rebecca spoke about who your collaborators are and who can support you. And I know that you did some interesting work around, or worked with community researchers. I wondered if you could kind of really briefly mention a bit about that.
Yeah,
Bianca.
Yeah, no, definitely. Thank you very much. I was wanting to find a chance to speak about them. So under Bristol and Matthew, we had a team of, it was around 20 community researchers who were trained up by Matt and other professors in both quantitative and qualitative research. So these were people over the age of 50 who, I think aside from a couple, didn't have any kind of experience of academia, apart from perhaps having gone to university for undergrads. So these were people who were sort of being trained up as community researchers, some people call it citizen research, and supporting the evaluation of the Bristol Aging Better programme. So some of that was actually particularly helping people to complete those questionnaires that use those loneliness indicators that Luke was talking about earlier, but also doing some more qualitative things, such as they did early on asset maps of 2 areas of the city, which had been identified as areas where there wasn't a huge amount of information about what the services were in those areas. They were neighbourhood partnerships at the time, but essentially 3 council wards, and what social activities there were in those areas. So there was a physical map that I helped them create, but they basically just physically walked around those areas, spoke to people, sort of saw what was going on, and that was really valuable. And then they were fantastic also when a few came back on board in the last year, when we had a small amount of ageing well money, so NHS money, to carry on some of the successful approaches from the Bristol Aging Better programme, to do some qualitative evaluation of some of the projects we were running. So writing some case studies from some groups that we'd funded of older people. And I think what came out of that, the case studies they've written are such high quality. And I think that comes both from having people who are doing it because they're passionate about it, and also the approachability of having a fellow older person go and speak to people about how has this project made a difference to your life, and what else would you like to see change in Bristol. I think that has a value beyond it just being an employee of a third sector organisation. So yeah, really high qualitative evaluations that came out from the community research.
Thanks, Bianca. They sound really valuable for the work. I'm sure we can share more information about how it worked offline. To kind of moves on to the next part of the training that Luke shared with us about kind of indicators and data. Matt, I'd be really interested to know around within that evaluation whether there was any kind of key I know you talked about kind of loneliness being your focus, but were there any sort of key indicators or data sources that you use that might be of interest to everyone on the call?
Thanks. Yes, I suppose I'd say things about 3 kinds of indicators. One to do with potential impacts on individuals' lives, on lives of older people. The second about older people's engagement type data. And the third one about indicators to do with evidencing more policy impact, systems change. So the first one about is about those kinds of outcome measures using validated tools to evidence impacts around social isolation, loneliness, and well-being. My reflection is that the challenge here is this is primary data, it's resource intensive, but if it illustrates one thing more than anything, it was the bit where our audiences prick their ears up. Now, a lot of what aging-friendly work is often, it's background work, it's building relationships, it's strategic change and so forth. But the thing that audiences, the so what question they're always asking is, what are the impacts for older people? So I suppose really whatever your level of resource, if you can invest on examining potential impacts for older people, things like isolation and well-being and loneliness, they all sort of gather together the potential sort of collective effects of many sorts of things. It could be anywhere appearing in that WHO flower framework. So they do express an important change. As Luke described, thinking through the design is really important, and coming to that point where you can plausibly come up with statistically significant evidence of impact of change. That's the big one that's kind of technically important. But sometimes that can be done with some careful sampling and some focused attention. Sometimes the convenience approaches and so forth, scattergun work, can feel like the easy thing to do, but you end up with problems at the other end. So design behind the indicator plan is thoughts and careful planning. Don't throw everything, don't try and do everything, just keep it focused on something. Bianca explained really well about then all the qualitative research from credible, in our case, community researchers to join the connections between the sort of bigger work of age-friendly down to plausibly how might, in certain cases, that impact upon the lives of older people. So getting those
where we can draw those connections down to that impact, at least having some of those examples.
Yeah, and then really just very briefly, the other two are that there are some easy wins, which is perhaps the biggest plausible indicators of good things happening through age-friendly work is just engagement data. Records of older people's participations in consultations, getting those numbers, volunteering activities, and agency participation in consultations. All of those, I'm sure everyone knows it, but those prove really useful and they tell a really good story. So it's an easy win there. And then evidencing policy impacts. Bianca's example of getting signed up actions is a really good platform for evidencing this. When do you obtain low frequency, high impact events, type impacts? So for instance, a change in policy within the local authority, a shift in funding decisions, a new alliance that forms. They may not come along very often, but if you can track using an audit of your data about what your team did to impact upon that big decision, then it's not going to light everyone's interest, but it will show some key decision makers the value of your strategic work.
Great, thank you, Matt. So yeah, really important to look at those two different levels. And just, we've got 1 or 2 minutes left, but so to finish up off, I'm going to come back to Bianca and see if there's any kind of top tips or things you want to leave anyone with that you haven't already mentioned, that you may have already done. Then I'll pass the floor back to you before I move us on.
Yeah, so I think I mentioned this in my breakout room. So in terms of indicators, and probably a chance to kind of list some of our specific indicators as well, just thinking about what is most likely to prompt action from whether you're particularly looking at your administration or third sector organisations. So looking at things like, and Aging Better's website is brilliant for this, actually, the state of ageing section, where you can kind of quite easily get data up around things like amount of pension credit claimed, and from that you can look at likely amount of pension credit unclaimed in your area. How many older people local older people are renting from a private landlord. There may be an existing survey done by your local authority in Bristol, it's something called the Quality of Life Survey, or you can look at doing one if you have an older people's forum as well. And things like the percentage of older people who aren't currently confident using online services. And we could look at that in 2 ways in Bristol. So we could look at the Quality of Life Survey, but also a survey that was done through Bristol Older People's Forum, which I was thinking earlier as Luke was speaking, is a self-selected group, but it's also a seldom heard group, because we know that it represents a disproportionately large proportion of older people who aren't online at all. That was a paper survey. And then sort of looking at things like how many employers, say in the Bristol Chamber of Commerce, there might be some kind of collaboration where you have age diverse policies in their workplace, and kind of policies to improve recruitment and retention of older workers. So yeah, looking at those and looking at kind of what's good quality, fine if it is sort of self-selected, or you've had to do it in an easier way. What numbers are actually likely to prompt further action and be a good indicator of is what you're doing the right thing. And then I think, the other thing was just building flexibility. If you are working to an action plan, building flexibility to emerging needs. New needs are emerging all the time. So in Bristol, for example, a couple of the actions have actually been changed in response to the pressing need to do specific work around cost of living.
Mm-hmm. Thank you, Bianca, and thank you, Matt. That was really, really useful to add some real life colour to some of the more jargony things. Matt, very quickly.
Really quickly, which is test your indicators and emerging evidence with downright skeptics. Perhaps journalists can be quite good, who will just ask very basic questions. You need to escape your own echo chambers. And usually you'll find that they want to know what is the impact for older people and what can you do in that space.
Thank you, Matt. Yeah, so echoing Luke's point about testing your surveys, test your indicators, test everything out with older people and skeptics as well. Thank you so much. I'm going to move us on now into our slightly longer break. So I'm going to give us 10 minutes. So if we are happy to be back here at 11:43, and we will move on to some of our stories work. But thank you to colleagues from Bristol.